So people will say, you know what? I'm just kind of noticing that like I've exceeded my ability to deal with other people's BS. Like I'm getting short with people. I'm snapping at my kids. And I have told them to clean up the toys, but I can tell it's not about the toys. Like, welcome back, everybody. I'm Dr. Bishop. I'm a board certified family practice physician, and I also spent 10 years in the Air Force taking care of F 16 fighter pilots. And it doesn't matter if it's F 16 fighter pilots or one of my patients that I see in the clinic. Family practice is one of the areas where there's no filter between me and the general population. So whatever is out there, I see. So anxiety and panic attacks make up a tremendous amount of my practice and one of the most common things that people deal with on a very regular basis. So let's talk a little bit more about what it is and what we can do. You know, if we really oversimplify mood, especially anxiety, I tell people to try to think about it in two buckets. On one bucket, you have all the stressors in life. Worried about your health, worried about your relationships, worried about your future, worried about your finances. This bucket of stress is always changing and it's never zero. And interesting enough, we don't want it to be zero. We want to feel like we're pushing ourselves, we're achieving our potential, but our mood is not solely based on the amount of stress in this bucket, but the difference between the stressors in our life and then our healthy ways to deal with stress. And when people I talk to are happy, they look like this. They're like, yeah, man, I got some things to worry about, but I could probably deal with a little harder day than what I had today. Like I've been doing pretty well in managing my stress. In comparison, when I talk to patients who are experiencing symptoms, those symptoms can be very broad ranging. So people will say, you know what? I'm just kind of noticing that like I've exceeded my ability to deal with other people's BS. Like I'm getting short with people. I'm snapping at my kids. And I have told them to clean up the toys, but I can tell it's not about the toys. Like I just have a really short fuse. People will notice that it's not necessarily yes or no answers to whether they feel anxious or they feel stressed. They'll start to notice more and more symptoms over time. People are like, you know what? I just can't shut my brain off at night. I seem to be just like worrying all the time. I'm having a lot of intrusive thoughts, like thoughts and worries just pop into my head and things that I'm just stressed about and I can't seem to stop worrying about them. And a lot of times on my way down to go to bed, it seems to be even worse. At night, I'm just like left alone with all these thoughts and worries, and it's now affecting my sleep as well. I see it across the board. This is one of the most common things I see in primary care, and I really can't convey to people how normal it is to have these feelings. I have a lot of people who feel ashamed. I have a lot of patients who feel embarrassed because of their symptoms. People who tell me, quote, I feel crazy if I need a medicine, and I can't convey to you how normal this reaction is. People notice that they're feeling more anxiety. They feel like a sense of a fight or flight response that seems like it's always there. This is an overactive fight or flight response from the portions of your brain that are just programmed to keep you safe. And they're noticed that there's things that you're worrying about and they're just taking it too far. These older portions of your brain, like your limbic system, are essentially meant to keep you safe from saber-toothed tigers. And even though there's no saber-toothed tigers around, they tend to make a really huge deal about stuff like the bills and stressors at work. And so your body is responding and your limbic system and your fight or flight response are all teeing up and responding like you're fighting a predator when it's really just a deadline that you're coming up against. Part of it is to understand where those symptoms are coming from, know that it's completely normal. It's addressable. It's something that we can treat. It's something that we can fix. It's something that we can work on to make much better with time. There's a lot of options that you have. Please don't feel discouraged. Please don't feel overwhelmed. Know that it's going to get better. I have the luxury of working with a lot of patients who feel drastically better with time. The thing I want to say about anxiety is manifests in a lot of different ways for different people. So one of the most common things that I tell people is it's not necessarily a yes or no answer. It's always this balance of kind of stresses we have in our life and then healthy ways to deal with stress. Now, it'd be great if people started feeling stress and they just automatically increased their healthy ways to deal with it and then they just didn't have to worry about it anymore, but that's not how things work. I talk to a lot of patients who be like, well, you know, my husband lost his job, so I don't have as much time to go to the gym, and I've been drinking a little bit more to shut my brain off at night. We tend to self-sabotage and give ourselves less ways to deal with anxiety, the worse our anxiety becomes. So a lot of times my job as a family practice doctor is not to fix this bucket. The reason that things are in this bucket are because they're stressors that we can't fix. That's the whole reason they're stressors in the first place. Otherwise, they would have been something we just checked off our to-do list a week ago. So we rarely have much control over the stressors in our lives. And I talk to people who spend too much time spending their efforts focusing on trying to make this bucket zero. And that's not how it works. They'll say, yeah, if I just made a little bit more money, if I didn't have this jerk boss, if my dad didn't have cancer, I'd feel a lot better. No doubt. I agree with you completely. That is going to fix the things long term, but we now need to address your healthy ways to deal with stress until those things can resolve. It's going to take time for those things to go away. We want to keep working on those things. A lot of them aren't going to be in our control in the first place. So we only have the option of addressing the bucket of stress reduction techniques. So in this bucket, I tell people there's 5 main things for us to think about. And it is not my job to tell you what to do. I have a lot of patients that have different preference on how to approach this and a lot of variability in how people respond to each one of these techniques. You need to think about what you want to do and then make a commitment to it. So everybody kind of ranks those things in their head from things that they're already doing to things that they really want to avoid. And then we kind of work up and down this list of healthy ways to deal with stress until we get better control of our symptoms. So briefly, the things in that bucket are exercise, meditating, talking to a counselor, medications, and yoga. So I always tell people, let's think about something that we're already doing. Somebody says, hey, I'm already exercising an hour every day. Great, that's fantastic. They're like, well, for me, I'm right here, and I think next I wanted to download one of the apps and try some meditation. And then if that doesn't work, then I'm going to try doing some yoga. And if that still isn't better, then I'm going to start talking to a counselor. And if I'm doing that for 6 months and I still don't feel better, then I'm going to consider starting a medication. So we kind of work up and down these things together. I try to encourage people, try not to just rule out something completely that you'd never try, but we can kind of talk about the different options and what needs to be a better fit and what things we kind of want to hold off till later. So exercise, super important. Primarily, it is cardio, I think, is going to have the biggest impact. There's no great studies that I've seen that show a strong correlation between one specific type of exercise and one specific type of mood disorder to fix it with, but in general, it makes sense. Cardio, running, doing both aerobics and anaerobic cardio is a good way to start lowering that stress. And that's typically people will think about running, they think about obviously yoga. Those things will help to have a particular benefit. And I mentioned yoga specifically is separate from exercise. There's some studies that show, think about yoga as almost a blend between meditation and exercise, so you can get a lot of additional benefit in comparison to just exercise alone. That brings us to meditating. So meditating is probably one of my favorite ways to address anxiety and panic disorder, is because it's really addressing the underlying problem that's going on. When we think about stress, one of the analogies that they use in meditation is picture yourself standing in the middle of the highway and all these cars are barreling down at you and your fight or flight response is elevated, you're panicked, all you can do is focus at this car that's in front of you, and as soon as that car gets out of the way, there's another one right behind it. And feeling anxious and feeling panicked almost is like your entire day is spent out in traffic and you're just dodging out of traffic. You don't feel rested, you don't feel safe. And the point of meditating is not to stop the cars. Again, the cars or the stressors are always going to be there in life. The point of meditating is get yourself out of the highway. So now picture that same scenario, except in not standing in the middle of the highway, but now you're sitting on a park bench, calm, relaxed on the side of the road, and just watching those cars go by. Cars are always going to be there, but it's the way they affect you that is much different. And that's what meditation teaches us to do, is to be present with the things that we have to worry about, not to feel overwhelmed. We have a tendency with everything that's uncomfortable to want to mute and numb and distract and to try to make it better. But in a weird way, when we start to let them pass in the distance, the more our brain learns how to do that, the better it is. And interesting enough, in studies with meditation, there's something that we see called neuroplasticity. Neuroplasticity means that when we do MRI scans after people are meditating for a few months, we actually see a change in the shape of their brain. In the same way that if you exercise your bicep for a number of months, your bicep will get stronger and you would see a difference. And we see this in brain changes in people who are meditating. They grow the portion of their brain that is associated with calm, and they shrink their amygdala, which is the portion of their brain associated with the fight or flight response. And so your brain gets better at not worrying over time the more that you stick with it. Lastly, I want to talk a little bit about medications and talk a little bit about talking to a counselor. So counseling is tremendously effective. I always tell patients a funny story that, like, my wife and I, we go to Chick-fil-A. She always has to drive, and that's a different problem altogether. But when she gets all the food, she sits down, she looks through the bag of food, makes sure we have everything we need, and she start driving home and have a couple of bites of fries on the way home, and I get pissed. And she's like, why you get so upset? I'm like, well, you don't eat your fries first when you get home anyways. Why do you have to eat them first right now? She's like, why are you so upset? I'm like, why am I so upset? Well, it turns out when I was a kid, my dad used to not wait very long when he would get his food, and he would eat whatever was in front of him in the bag. Sometimes that was your fries, sometimes it was your nuggets. So my siblings and I learned to be really protective of our food when somebody else has it in their possession. That's a small thing. That's a little T trauma. That's not a big T trauma. However, that taught me going into those situations where somebody else has controlled my food to have a little bit of anxiety. That's a small insight into how understanding how we approach problems, maybe something learned from when we were a kid, maybe it's something that we've struggled to change even though that we know what we're doing, can help us change the way that we're approaching situations. Now we still go to Chick-fil-A, nothing changes. My wife still likes to eat fries on the way home, but now I understand why I felt that way. And the interaction goes much different because of that ability to understand and that insight a little bit more. Lastly, let's talk about medications. So medications for anxiety can be extremely effective for many patients. These medications, we think about SSRIs, particularly we think about Lexapro, Zoloft, we think about SNRIs, and I would like to specifically say that we want to avoid benzodiazepines as first-line treatment. There's good evidence that would show that it is not as effective as SSRIs, comes with a lot more side effects, but there is a role for benzodiazepines, so we can come back to it. SSRIs, if we had to design a perfect medicine, we'd want something that you could take every day and it keeps a stable level in your system. You want something that doesn't have a bunch of side effects. You don't feel like you're taking it. You want something that doesn't have severe withdrawal symptoms when you stop taking it. You want something that doesn't have tolerance where you kind of need a higher dose longer and longer that you take it. And you don't want to have to worry about end organ effects, increased dementia risk, cancer risk, changes in kidney function or liver function. And I'll say SSRIs check a lot of those boxes. There can be some discontinuation syndrome when people take SSRIs. Sometimes people do feel better at higher doses, but we don't see just perpetual tolerance that we would expect over time. So SSRIs can be extremely effective. I'll say, when I talk to patients who start taking SSRIs, Zoloft is maybe one of my favorite ones in particular for anxiety and panic attacks, seem to be very effective. And when I talk to people, it goes the same way. They come back in about 4 to 6 weeks and we check back in and see how they're feeling. And the most common thing that people say is they're like, you know what, man, I really didn't feel like it was working. I didn't feel different. I didn't feel like a zombie. I didn't feel like I couldn't feel feelings. But I just started to notice that I felt better. You know, I was at work the other day and my boss walked in and he freaked out on everybody. And then he walked out and I was like, dude's a jerk. And I would never do that. Before, I would have cried. I would have had panic attacks the rest of the day. It would have ruined my week. And so stuff was happening and it just didn't bother me the same way. And they're like, you know what, man? Like, honestly, I feel more like myself now than what I did before when I was anxious and I was panicked all the time. Like, strangely, I don't feel like a zombie. I don't feel like I can't feel feelings. I just feel more like myself. So I don't know, man. If that's what the medicine's supposed to do, then it does work. And that's a common thing that I hear from SSRIs. Typically, when we're using a medicine for mood, you want to take it for, say, anywhere from 6 months to 2 years is about average. I recommend people commit to at least 6 months to 12 months. If you get feeling better with an SSRI and then discontinue, there's a 50% relapse rate if you stop within the first 12 months. So it's kind of something you want to commit to for at least a little bit, but it's not something that you can expect to be stuck on and you just need it for forever. When I talk to patients who are feeling better, they're like, hey, you know what, man, now that I'm through the divorce or now that I'm done with law school, I think, I'm feeling a lot better. My stresses have gone down. I think I can stop the medicine and still be okay. And I see that all the time. There's a lot of people who do well in that scenario. But if you'd never replaced any of the coping mechanisms or your stress didn't change and you just want to stop the medicine for the sake of stopping medicine, then it's reasonable to expect if you dip down below what your ability is to deal with those stressors and they haven't changed at all, then the symptoms will come back. But in patients I have, you're like, you know what? Now I'm sleeping better and I'm exercising every day and I've stopped drinking and I'm taking better care of myself. I don't need the medicine anymore because I've been using healthy coping mechanisms. And that's ideally what we want. There are additional supplements that people like to take in order to treat anxiety. And I can say my personal view on that is, for me, if I'm going to take a medicine, I want something that has been proven in clinical trials to work. I want something where I know exactly how it's going to affect my system. I want something that I have clear package insert information on, and so I can see that this medication has been studied. Unfortunately, we don't have all that robust data with every supplement that people like to use. I do like magnesium, which can really help to balance out people's kind of fight or flight response, and it helps to balance out glutamate, which is the overactive neurotransmitter in the brain that tends to make people feel a little bit anxious. I would be careful about ashwagandha. I've just had a couple patients who have had some GI upset with it, stomach upset, and additionally some changes in their liver function testing and some strain on their liver. St. John's wort similar can have some stomach upset with patients. I'd be very careful about using a 5-HT supplement. I know that some patients have had some tremendous benefit with this. There's some concern that 5-HT used as a precursor can help deplete some of the precursors for dopamine, and over time can induce depression. And I have some patients that will use supplements with fantastic results. It's not my job to tell people what to do or what not to do, but if you're really opposed to taking a medication, please talk to your doctor and ask if it might be a reasonable option to consider other over-the-counter options before prescribing a medication. I can say after a full conversation with many of my patients, when we look at the pros and cons, for me personally, if I'm going to take a medicine and put it in my mouth and it's going to go into my system, I want it to have an effect, I would prefer to use something that is FDA approved, something that my doctor can help me monitor closely with time, and something I know has been shown in studies to have proven benefits, and that's covered by insurance. A lot of times the great thing about these medications is first SSRIs came out in the 1980s, and people have been taking the same dose for 30 years. We've had tons of studies on it, and they've had a proven track record. It's not that they're for everybody, but if I had to take something, I'd probably go with something that was cheap and generic and had some good studies behind it, instead of a supplement that may or may not have the same quality because it's not FDA regulated. But I really encourage everybody to do what they feel comfortable with. It's not up for me to tell you what to do. You have to talk to your doctor and talk about different options together. SSRIs are not for everybody. Medications are not for everybody. Supplements are not for everybody. Exercise isn't for everybody. So talk to your doctor. Make sure that there's not any underlying problems that are causing your symptoms. Once you get a clear diagnosis of panic disorder or anxiety disorder, then work with your doctor in those healthy coping mechanisms that you need to start feeling better. Briefly, let's talk about benzodiazepines. So benzodiazepines are extremely effective, but the problem is they only fix things in the short term, and they're not a long-term solution. And long-term, they can make things worse. In benzodiazepine use more than a few times a week, it will actually increase your baseline anxiety. It will affect sleep and increase cortisol levels from your adrenal glands to where you're actually feeling worse at a baseline. So all the ups and downs that come along with benzodiazepines can be something we really want to be careful about. When are benzodiazepines effective? I certainly would consider a patient who had never had any history of substance abuse, but patients who are finding themselves in very stressful situations. Probably the most common thing you can think about is flight anxiety, although it's worth noting that flight anxiety can be treated without benzodiazepines. But this is often where people will be like, you know what, I don't necessarily want to have a couple martinis in order to feel relaxed on my plane, but it makes me feel very uncomfortable when I'm not in control and I can't see out of the front. So I will have a small dose of benzodiazepine just in case I need it, that I can use as rescue. And a lot of times patients will tell me, hey, if I just have something, if I have 5 tablets of a short-term benzodiazepine, it's almost like a safety blanket for me. Like, I know if I really needed something and I started feeling like the walls were closing in on me, I could take a medicine and it would help. But just knowing that makes me feel better. And that's what we'd like. Get patients to the place where ultimately they're not needing benzodiazepines. We can use benzodiazepine use as a good barometer as to how well people are doing. So people are like, you know, I used to have panic attacks 2-3 times a week, and now I haven't had a panic attack in probably 2 or 3 months. I certainly wouldn't use benzodiazepines more than twice a week. If you're needing it more than twice a week, that tells you need to go get a better control of your baseline symptoms. You don't want to just be treating everything as a rescue symptom. You really want to save those for just like emergency situations where you're finding yourself in a bad situation, panic attack, where you're saying, either I'm going to go to the ER or I'm going to take a benzodiazepine. Those are kind of the only options that I have to try to calm down. There's just a lot of problems with long-term uses that I think has been well documented. Lastly, I really want to caution people against self-soothing techniques. So when we feel anxious, inevitably people want to treat it. They want to feel better. It's a very uncomfortable thing to feel that anxiousness. So patients will often try to self-treat. And this self-treating behavior is something that I really want people to be careful about. Self-treating would be people who find themselves drinking a little bit more, people who are smoking more marijuana, people who can't shut their mind off at night. They have to take more and more medicines to go to sleep. People who are finding that they're anxious in normal situations and they are needing to treat themselves with alcohol in order to be around other people and to help with that anxiety. Anything that you're finding that you're leaning on, those things like alcohol in particular that people use as a kind of a band-aid or a coping mechanism for anxiety, can make things worse long term. It's going to affect your sleep. It's going to make your baseline anxiety increase. So we really want to cut out coping mechanisms and self-treating behavior and make sure we're focusing on giving yourself healthy outlets for stress in order to balance out that kind of unopposed fight or flight response that people can feel. I really encourage you to think about those different options that you have to treat anxiety and panic disorder, and talk to your doctor and find a balance of things that you think is going to work for you. Have a doctor that you trust, that you feel like if it's not getting better the first time, that you'd feel comfortable talking to him about all the things that you're struggling with and all the things in your medical history. It's very important to make sure that the doctor that you're talking to, the primary care physician, is able to see a full picture of everything about you and know your hormone levels and know your thyroid levels and know the stresses in your life and know the common ways that you tend to self-treat, and they can help keep you accountable for those things. It's really important to find a primary care physician that you feel comfortable talking to and be open with them about this. I can tell you they deal with it all day long, and I can speak for myself when I say when I have patients who come into my clinic with anxiety, it's probably one of my favorite things to treat, is because people feel so much better. And it's a tough situation, and we see instant improvement as people start making the small steps that it takes in order to feel better. And on the other side of feeling anxious, people are very happy. They are tremendously grateful that they've found the ability to feel better. And the most common thing that I hear from people is they want to tell others about it. They want to go help their friends. They start talking to everybody. At first, they were ashamed to say they were taking a medicine, and now they're telling all their friends that they should consider taking a medicine and go and talking to a counselor. And people who are very resistant to treatment in the first place, once they see the improvements, they feel tremendously better. So please don't feel discouraged. Please make sure you're talking to your doctor and be honest with your doctor about the symptoms that you're having, especially if you're feeling like thoughts of hurting yourself or somebody else. I can't tell you how common that is for people. And I treat that like other symptoms that you're dealing with. If you woke up and your knee was swollen, you'd say, I need to go talk to my doctor because this is obviously a problem. It's the same thing with those symptoms. And those are symptoms that will get better too. Thank you for your time. I really hope that if you're struggling with anxiety, that this can give you some insights. If there's something else that you found that your doctor said or something that helps you, I'd love to hear about it, and we can tell other people so they can help get better too.